So good evening, myself Haseena from the Department of Psychology. So in this video, we are going to discuss about a few other disorders that caused by substances like alcohol, hallucinogen, LSD, etc., etc. So the first one is post-hallucinogen perceptual disorder (PHPD). So it is nothing but some users may experience a flashback, that is that they might experience their old memories. So it may cause even after years or weeks later. So it is spontaneous re-experience after the LSD usage. LSD is nothing but a drug that causes hallucination, anxiety, visual distortion, and emotional mood swings. So one theory is that LSD causes biochemical changes in the brain that persist even after the drug is gone. So many theories and researchers are suggesting that this LSD, that lysergic drug, may cause biochemical changes in the human brain even after the drug's power is gone. So the next one is traditional and religious use. So some hallucinogens like mescaline and psilocybin or Native American and African spiritual rituals. So some hallucinogen drugs like mescaline and psilocybin. So these two are some of the common spiritual rituals that are followed by the Americans and Africans. So they believe these two drugs allow them to communicate with spirits and God. The next one is psilocybin, that is PCP. So it was originally developed in 1957 as an intravenous surgical anesthetic drug. So this PCP psilocybin was originally developed at 1957 as an anesthesia drug. So however, so 10 to 20 percentage of patients experience severe side effects because of the drug. So it causes delirium, hallucination, and some other mental disorders. So due to this reaction, so its medical use was discontinued. So they withdraw the usage of PCP in medical field. So example, a patient who received a PCP during surgery might experience hallucination or anxiety. So later, so this was discovered in a study. So the next one is PCP. So it is now illegally manufactured and it is very commonly available drug in the street. So the common names of PCP are angel dust and crystal. So it comes in many forms. So we can see it in a tablet form, capsule, powder, and these are the angel dust and crystal. These two are the local names for PCP. So it is sometimes sprinkled on marijuana and then smoked. So people may intake these type of drugs in many forms. So it can be swallowed, sniffed, or injected. The next one is inhalants. So the inhalants are one of the psychoactive substances that people may intake through inhaling. So to produce mild altering effect. So inhalants will. So if people are inhaling it, it will create some psychotic reaction and it will alter their mind. So these lungs have a large capillary surface area which allows substance to quickly enter into bloodstream. So inhalants will allow the substances to quickly for quick reaction. So it will directly affect the bloodstream of an individual. So it will lead to intense intravenous drug usage but without any needles. So some common type of inhalants are gasoline, lighter fluids, spray paint, cleaning fluids, blue nail polish remover. So these six are some of the common type of inhalants that people might get addicted to it. So the next one is cannabis. So cannabis is a plant that has been historically valued. So it is so cannabis may have different forms. The common types of fibers, oils, psychoactive resin. So it will alter the human minds. The next one is marijuana. So marijuana is a dry leaf and flowering tops of the plant. So it is a plant. So it most commonly used in United States. So they smoked or ingested for psychoactive effects, to get hallucination, to cure their anxiety, depression, to recollect their memories. Some people use it as psycho to get the psychoactive effects. So the TCH is responsible for most of the effects of marijuana. So tetrahydrocannabinol. So it is one of the psychoactive compounds which create a different effects while inhaling or taking the doses of marijuana. So after taking a single dose, so people may get addicted to it, and that it may cause some other medical disorders. Next one is how cannabis is consumed. So for marijuana, we have different ways to use. So for cannabis, people may inject or inhaling to get the effect. So thank you. We'll continue the next disorders in the next video.